uninsured people means in general, and what it means for free and charitable health specifically, and kind of the whys. And I guess the other thing, if you've ever seen something like this, which I can't imagine you have, this has got to be an unprecedented situation during your experience in charitable health, but kind of talk through all of that stuff. So, I guess my first question for you is what are the forces at work that have caused the uptick in the rate of uninsured for the first time since the implementation of the Affordable Care Act?
Well, I think there are a couple of factors, uh, not not the least of which is that premiums have increased year over year. Premiums stayed pretty flat from 16 into 17, and then we saw in 18 a pretty significant increase in the average health insurance premium for someone on the exchange. And I mean, this is the subset of the newly insured that we're really focusing on here. And so, according to CMS latest data, in the first half of 2018, the average health insurance premium was $595.89. That's a 26% increase over 2017. And so clearly, when you have a budget and you've got a line item in your budget that increases, 25%, you're going to make decisions about if you can afford that. And I mean, I think we're seeing the answer to that, and that people are dropping their coverage. Now, the second really crucial piece is that this year Congress, in the Tax Reform Act, did away with the penalty for not purchasing health insurance. When the ACA was passed.
Yeah.
Go ahead.
Is there like a definable correlation to when the individual mandate was removed from the legislation? Like, you can directly see the correlation between the removal of the individual mandate and the uptick in uninsured?
Well, I mean, I'm not sure, which is more important, the premium increase or the fact that I'm not going to get penalized for not having health insurance. I mean, in the past 6 years, if you did not have health insurance when you did your taxes, the federal government said, okay, you have to pay a penalty. Now, sometimes small as $250.
Mhm.
It was still an incentive to purchase the insurance.
What's caused the premiums to go up in the last few years on the exchange?
Well, I mean, I think that there's no question that if people are accessing the healthcare system now that they have a payer source, that costs are going up for insurance companies. And so, it's probably just a simple business decision that the insurance companies are looking at their increase in costs and saying, okay, we've got to forecast for next year. So in order to build those increased costs in to our planning, we have to raise premiums. So, part of the ACA, does give some, some free benefits to people. The screenings, the preventative screenings, colonoscopies, and mammograms are basically free under the ACA policies now. And so
for the individual patient.
For the individual, right.
Yeah.
But a health insurance company has to pay that. And so, part of the makeup at the ACA is that the health insurance companies are having to pay more. But don't forget, Josh, that this whole thing was built with the individual mandate in mind, where the young and healthy individuals were going to be compelled to purchase health insurance. And what is an insurance? It's a pool of people who are all doing virtually the same thing, but some people have an event that is requiring them to ask the insurance company to pay for it.
Yeah.
You have a bunch of young and healthy people in your system that pays for the middle age and older folks having to access the system just because you get sicker as you get older.
So, if I remember right, we went from like, what is it, 19 states that hadn't expanded Medicaid, and then the last election we're down to 16 now. Is that right? Something like that.
Yeah, 17, I think.
17. Do you think is Medicaid expansion going to mitigate the uptick in uninsured to, I mean, obviously, well, to some extent, but is it going to do it to an extent that matters?
Here's my concern about what's happening with Medicaid now. I think 5 states have now implemented a work requirement or an attendance requirement at job training to as part of the eligibility process for Medicaid. So in those states, I think we're going to see a pretty significant drop off in the newly covered Medicaid recipients who can't meet that requirement. Otherwise, in the states that have not put that barrier or eligibility process in place, from what I hear, folks are staying on Medicaid. And so I believe that the drop in insured individuals is coming from the exchange providers and
exchange plans.
Maybe from small businesses who were providing the premiums or providing insurance for their folks. But, as the premiums have gone up year over year, they're just getting squeezed.
So I read a thing on Forbes today that said the uninsured rate is up to like 15 and a half from 12.7
Right.
in the last 2 years. And the thing that was really alarming to me was there was a paragraph after it talked about, the uptick that said by the time the next recession hits, it could get as high as 20% uninsured. And that,
Right.
like 1 in 5 people without health insurance, like we're back to almost pre-Affordable Care Act levels, right? So I'd love to hear, as someone who has a lot more experience in the charitable healthcare sector than I do, I'd love to hear you talk about what the reality of a 1 in 5 without insurance world looks like.
Well, that means that a lot of those free and charitable clinic patients that were able to leave their medical home in the free and charitable clinic because they were able to either find a job that had health insurance benefits or were able to purchase health insurance on the exchange with the subsidies, may roll back to the free and charitable clinic if they lose their job, or their hours are reduced to the point that even with the subsidy, they can't afford the premium. So just as an example, Josh, for a family of 3, a mother and 2 young children, if she's got a good job and is making $30,000, then her monthly health insurance premium out of pocket is $95. And so, even at $30,000, $95 is a a decision point for her.
Yeah, I mean, depending on where you live, if that person's in LA with two kids, $30,000, you know, that doesn't
Yeah,
go for, I
right.
mean, maybe
I
if
mean,
they're in Memphis, they're okay, but
$600-700 for rent.
yeah,
Food. She's got a car because she's probably driving to work, car insurance. And so, I mean, there's a real juggling act, even with the subsidies,
yeah,
in people being able to afford this health insurance. And if you drop back to that income level of say $20,000 for a family of three, then when you're going about trying to get health insurance, this big light lights up and said, you're eligible for Medicaid. But if you're in one of those 17 states that did not expand Medicaid, you're totally out of luck.
mm,
Because remember, the subsidies start at 100% of the federal poverty level.
mm,
And so if you make less than that, and for a family of three at 100% of the federal poverty level is $20,780. And so
jeez,
if you are making 21,000, then you get to have the subsidy kick in. But if you're making 20,100 and your state did not expand Medicaid, I
tough.
mean, your premium is still the premium for the policy is still over $1,000.
Sheesh.
Absolutely no way for a family of three. Absolutely no way someone with a $20,000 income is going to pay over $12,000 of that for health insurance. Ain't
Yeah.
happening.
Um, I think I've heard it in you telling me about this. But so what do you find the most frustrating about this uptick in the trend and just kind of, I mean, if we're being fair and honest, this is a regression. This is a step back in equitable healthcare in the country. I know how I feel about that, but I'd love to kind of hear your thoughts and frustrations in general, and particularly
Well,
the why behind them.
yeah, the why is the frustration because it doesn't make economic sense to me because there was the old commercial from Midas, I think it was, pay me now or pay me later. And that's really what we're talking about when it comes to healthcare, because there's study after study that proves that if you do not have health insurance and you become ill, you either medicate or don't do anything until the point that you've gotten really, really sick. Then you go to the emergency room, which is the absolute worst place in our healthcare system to access primary care. It's the most expensive. It's time. And my daughter waited over 8 hours in the emergency room
Mm,
last month, and just never really got anywhere. Uh, and so the frustration is that politicians don't understand or don't acknowledge, or I don't know where the disconnect is, that investing in your people by providing a payer source so that they can remain healthy and productive and taxpayer makes a lot of sense.
mhm.
And I don't know what it's going to take in this country for us to come to that realization.